I think we agree in the field that progression that is not manifested by disease activity is the most important problem that we need to solve.
So GAVOT confirms the favorable benefit-risk profile of the approved dose of ocrelizumab in primary progressive MS.
Overall, OPERATA 2 demonstrates the safety and efficacy of ocrelizumab as a potential treatment option for pediatric onset MS patients.
And we've seen a biological effect of metformin and clemastine. And following the CCMR1 trial of bexarotene and the rebuild trial of clemastine, this is now the third time we've seen a detectable effect in people with chronic stable optic neuropathy. However, the effect size was small. This provides justification to longer-term remyelination trials.
Participants treated with fenebrutinib for 2 years had near complete suppression of disease activity, reflecting the impact on both relapsing as well as progressive biologies.
In a large primary progressive population involving older and more disabled or advanced disease, ocrelizumab was superior to placebo in overall disability progression and worsening on upper limb function. And I hope it sends a message to people with MS we won't give up on them when they become wheelchair users.
Broadcasting directly from Barcelona, Spain, you're listening to the ECTRIMS podcast, the official podcast channel of the European Committee for Treatment and Research in Multiple Sclerosis. I'm your host, Brett Drummond, and welcome to this special Congress series. And now, the final day of ECTRIMS 2025 has arrived. Across the past week, Barcelona has been the hub of the MS world, with more than 9,500 neurologists, researchers, and healthcare professionals gathering to exchange ideas, test new concepts, and form collaborations that will shape the field for years to come. We close with one of the most anticipated notes of the meeting, the late-breaking abstract session, where the results of many clinical trials have been unveiled for the first time. These sessions are where fresh data meet eager discussion, where treatments under development are put into the spotlight, and where the trajectory of MS research can shift in real time. It's an inspiring conclusion to a meeting that has once again shown the vibrancy, ambition, and collaborative spirit of the global MS community. To bring us inside those discussions, I'm joined by Sharmilee Gnanapavan, a neurologist at Barts Health NHS Trust, whose expertise in clinical trials positions her perfectly to share a first-hand perspective on what these findings mean for the field. Today, we bring you the key highlights of Day 3 at ECTRIMS 2025. Sharmilee, thanks for joining me.
Thank you for the invitation.
Before we get into it, I really want to talk to you about the late-breaking abstract session. We've just had that. There was a lot of key highlights and interest in that. Before we get into that, it's obviously the last day of ECTRIMS 2025. What have your overall impressions been of the meeting so far?
The meeting's been very diverse and lots of different things have been picked up on, made more sense to a lot more wider audience, in my opinion. So if you had an interest in basic science, it was there. If you had an interest in well-being, it was there. So I was quite impressed by how diverse the topics were.
Yep. Huge range of sessions. Let's talk about the one that you just had the difficult job of chairing, the late-breaking abstract session. It was a completely full room in there. It's one that everyone looks forward to on the program. Can you talk us through what some of the key highlights were from that session?
Well, the main key highlights was that it was more focused, in-depth mining into anti-CD20 therapies or anti-B-cell therapies. So we've all had a lot of unanswered questions about B-cell therapies, and it seems like investigators have been very busy getting this done. So a couple of the presentations are investigator-led, which was lovely to see. One of the things which was quite key was the pediatric study looking at ocrelizumab versus fingolimod showing superiority. And this is an area where more treatment is really needed and more treatment options, in my opinion. So this was nice to see. I would be interested to see what the long-term outcomes of B-cell depletion in the pediatric population would be. So I'm sure there'll be follow-through work on it. The other interesting thing was this focus on the more progressed population by Gavin Giminoni, looking at the all-hand study. And he had this very interesting length-dependent hypothesis, which is what it's based around. So, for example, if you look at the corticospinal tract, because of its extent length, what he was explaining was that you'll get multiple hits on it. So you'll get the walking difficulties first, but then you'll start to see the difficulties in upper limb. Now, for progressed individuals, maintaining their independence is very much dependent on upper limb function. So to, in fact, see such great outcomes on predicting upper limb function on the 9-hole peg test metric was phenomenal to see. And then there was the de-risking study on rituximab. Although that wasn't the primary outcome, it was to look to see if you can maintain efficacy by extended dosing. But it was still interesting to see that this is something to take forward as an actual clinical management plan now for rituximab. So these studies were very innovative and interesting to see. They pretty much had similar trial designs, but it was asking different questions of the B-cell therapy. So quite fascinating. And I would say every session was fascinating, like the session on remyelination. Now, this is something we've forgotten for years and thought that this isn't going to work. To have another phase 2 trial come online to show, okay, there is a signal there, but maybe it's something we need to work on, either with more potent drugs, but in my opinion, probably more extensive trial design. Like, for example, going on for 6 months is probably not enough time to really see clinical effect. So exciting session is the only way to say that.
Yeah, definitely. I think unpacking some of the things that you talked about and knowing, you've got a lot of expertise in the clinical trial area. One of the things that we've been pushing as messaging for a while now is the need for increased diversity across our clinical trials. For a long time, we had, a very standard cohort of people. We know now we've got people living with MS who live longer. They're often not included in trials. You've talked about, a trial there with more advanced people with MS. You've talked about pediatric populations. In your opinion, having sat through this session, how are we now going with that fact of getting clinical trials that are more representative of what we see of the overall MS community?
Yeah, I think it's been hard to get these trials done just because of regulatory rules. And it's taken time just to break through those regulatory barriers to say, look, this is what our patients want. I have read the umpteenth comment about patients wanting more progressive trials, more higher EDSS scores, older patients, younger patients. And we're finally having the enough time has passed that investigators can say, okay, right, we've got licensed products. We now want to ask those extra questions. So it's lovely to see that happening.
Yeah. Across, I guess, the rest of the meeting, across the 3 days now that we're on day 3, we can talk about the meeting as a whole. What have some of your other highlights been?
I have to say the poster sessions have been quite interesting. I find you can often get a lot of information from the poster sessions. There was material on EBV, which I found interesting. There was also biomarker sessions, which is a key area I work on, which was interesting as well. So, for instance, even coming to the meeting presentation on EBV, where lytic EBV, infection of B cells, are linked to relapses, was quite an interesting development in terms of EBV hypothesis and how it links to MS. There was also some interesting work. This was Simon Theobald who presented the findings, and he demonstrated that maybe more EBV-infected cells, really aged B cells, were present in the CSF compartment compared to the blood compartment, which is really interesting. So there's clearly compartmentalization differences occurring, which brings me back to why we still need to continue CSF work to understand this disease much better than we currently do. So hopefully this will encourage people to start thinking not just in the blood, but about compartmentalized inflammation and how even treatments influence that. But these were interesting findings. I did attend also the biomarker sessions. I think neurofilament light chain is now a very well established biomarker, in my opinion. We still need to understand what its role in judging treatment efficacy is, and that's going to be interesting to see. GFAP is going to be probably indicative of PIRA or progression independent of relapse activity. But there are some more interesting newer markers coming in, which are being presented by new technologies like O-Link, for example. So we may see a lot more biomarkers in the future as well.
Yeah. I want to talk slightly about the poster session, because this isn't something that we've talked about on the podcast so far during the week. It's not necessarily the science, and I'm about to unfortunately show my age as I talk through this, but one of the things I really noticed going through the poster session and the energy in that room was how many young investigators are here presenting their work. And I don't know if you found the same thing, but it has really seemed to be a meeting where we're getting, the next generation of MS researchers coming through, and they're presenting really great science.
You're absolutely right. I thought this is where you're going to see the new investigators of the future. I like to go around and ask people to present, do a little mini presentation for me.
Yeah.
It's so much more interesting than reading it yourself. So I'm always thrilled when there's a young investigator standing next to me.
Yeah.
Then I can ask some pertinent questions. So the energy is definitely there. And the support from the seniors is there for lots of them as well. So it is probably the best attended session at the conference. And it gives young investigators opportunities to network with established investigators, in my opinion, as well.
It's such a melting pot of the new and the old and all of the different healthcare professionals meeting in one space.
Yes.
It's quite a sight to behold. Thinking about that and thinking about where we're going next, we're coming to the close of ECTRIMS 2025. We can start to think ahead to MS Toronto. For you coming out of this meeting, what are some of the things that you're really looking forward to hearing about how they progress over the next 12 months when we get to Toronto next year?
So I really want investigators to push the barriers of what we think is how we're going to design clinical trials in a wider patient group. I would be interested in seeing more investigator-led studies being presented, also younger investigators presenting them. I would also like to see more targeted treatments, targeted at biology. So I'm hoping that some of this EBV work really brings back the resurgence of thinking of targeting molecular defects, which we're seeing, maybe even newer medications reporting. So hopefully we may see some new safety data from the anti-CD40 ligand treatments and trials, which are currently ongoing. So there's definitely newer things coming in, but probably also expand in the existing things in a more diverse patient group.
Perfect. As one last question, we're a couple of hours away from the Patient Community Day event. I know you personally have also in the past worked really hard to communicate outcomes from ECTRIMS to people living with MS. I'd love as a final thought for you just to talk about why you think it's so important that we do take all of the important science that's discussed here at the meeting and make sure it reaches the people who are most impacted by it, which is people living with MS.
I think it's super important for people with the condition to know that there are people working on it to try and find solutions. And it may not be coming today, but eventually what is evident from all of the presentation is that it will get there. And so this is having the actual input from them as well as being able to feedback. I think it's super important for people with a condition.
Yeah, well, thank you very much for giving up your time at the end of an incredibly busy 4 days. Your insights are much appreciated. Thanks for all of the work that you've done. And I'm sure everyone will really enjoy listening to it.
Thank you very much.
Thanks everyone for listening to our special Congress series, which has highlighted all of the standout insights of ECTRIMS 2025. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MS Translate. The ECTRIMS podcast is produced and hosted in collaboration with two key partners: MS Translate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community, and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2025-26 ECTRIMS podcast series is supported by educational grants from Alexion AstraZeneca Rare Diseases, Bristol Myers Squibb, Roche, Sanofi, and UCB. Educational grant providers have no input in the podcast content. Do subscribe to the ECTRIMS podcast on all your favourite podcast channels, including Apple and Spotify. Visit the official ECTRIMS 2025 website to learn more about the ECTRIMS Congress and join the conversations on X, LinkedIn, Facebook, and YouTube.